It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, we're back with our first guest, Dr. Heather Ostmann, primary care physician at the Everett Clinic at Smoky Point. GERD, GERD, is a form of, basically, I've had it. It's kind of a heartburn issue or esophageal issue, isn't it?
Boy, that's pretty good, Tom. That's exactly what it is. GERD is gastroesophageal reflux disorder. It's acid reflux that we're all going to experience at one time or another. So we're going to talk about that today.
All right. If you're experiencing something like that, here's what you need to know with Dr. Heather Ostmann and Shannon O'Kelly.
Dr. Ostmann, welcome. How are you doing?
I'm doing wonderful. It's good to be here today.
Well, it's good to have you here today because we're going to talk about GERD. And before we get into that, tell us about your practice, your training, kind of your interest. I mean, the day in the life of Dr. Ostmann.
Yeah, absolutely. So I work with the Everett Clinic. I'm located up at their Smoky Point location, just north of Everett. I've just been there about a year, so I'm one of their fairly new providers up there.
How do you like the North End?
I love it. So I grew up in the South End, so now I'm a North Sound person.
You're a Northerner now.
Good. That's correct, yeah.
Where'd you go to medical school?
I went to school at the University of Washington.
Okay, all right. That's okay. That's a great program. And you did undergrad there and then medical school there?
So my story's a little bit more twisting than that. So I did 3 years at Central and then got my undergraduate degree from the University of Washington, but didn't do all 4 years there.
And medical school at University of Washington?
Correct, for the whole time.
And then what about any advanced training, any areas of interest?
Absolutely. Well, at the University of Washington, I did not do any advanced training, but my residency was in the United States Navy, and I served 8 years with them. Just got out last year, and then the Everett Clinic is my first job back here in the Pacific Northwest.
Wow. Okay, first of all, welcome back, and welcome to the North End. And then lastly, thank you so much for your service. What a great sacrifice that you folks make. And being a Navy doctor, what's that like?
It's a pretty amazing experience. I had a great time with that job. It was a really good experience for me. I got great training with the Navy, and you'll never work with a better group of people. So it was really a privilege.
Okay, let's talk about GERD. Tell us what it is.
So GERD stands for gastroesophageal reflux disease, but it's much easier to say GERD, obviously.
So what's going on there?
Basically, it is a more chronic and complicated reflux. So almost everybody gets an episode of heartburn. Most of us are familiar with what that feels like and sometimes can be associated with overindulgence. But GERD is a little bit more chronic than that. So we sort of think people that are having symptoms more than a couple times a week, that might be a sign of GERD.
And let's talk anatomically, GERD. If you're having GERD, anatomically, what's going on? Let's discuss the fact that, your digestive system, particularly your stomach, is very acidic, and maybe get into a little bit of that anatomical, kind of physiological standpoint of why we have acid that refluxes up into our throat and esophagus.
Yep. So our gastrointestinal system is, if you think on it in simplistic terms, kind of a big tube. Right? And so you swallow your food, and certainly needs to be broken down by the acids in our stomach. And GERD really is reflecting when that acidic content comes back up into the esophagus. And so we don't have a lot of pain receptors in the stomach, but in our esophagus we certainly do. And so we'll feel that as a lot of pain and pressure in the chest. And sometimes people can actually get some sore throat from that.
And you can get a sore throat. You can get a little bit of hoarseness. A lot
Correct.
of people say in the morning symptoms are a little bit more pronounced, maybe?
I would say probably more classically would be in the evening. So you're having later meals, you go to lay flat, and some of that contents from your stomach is going to come up into your esophagus, and that tends to be a more common time that we will get it.
And when do most people start seeing this as far as presentation goes?
So it can happen to anybody at any time. It probably is more common as we get older. If you have had things like recent weight gain, that can sometimes make it worse as well. There's certainly a huge component of diet that plays into that. So there are definitely foods that we know can kind of make reflux symptoms worse. And those are things we're thinking sort of acidic foods, spicy foods, really fatty foods. For some people, caffeine or red wine or even chocolates can make this worse.
And normally, in a normal situation, that acid in the stomach that's digesting that food doesn't reflux back up because you have a sphincter there or a restrictor, basically, that's usually, when it's functioning, it keeps that acid in the stomach.
Correct. Yeah. And so that's the case for most of us. All of us probably have a little bit of reflux, but most of us probably don't feel that. Other people who have symptoms are probably having more of that that's coming up into the esophagus.
We'll continue our conversation with Dr. Heather Ostmann and Shannon O'Kelly. We're talking about GERD. What's it again?
GERD, Gastro Esophageal Reflux Disorder.
Okay, that's coming up next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our conversation on GERD continues with Dr. Heather Ostmann and Shannon O'Kelly.
Dr. Ostmann, again, thank you so much for coming down and joining us. And we're talking GERD. You've explained it. It's a reflux of acid from your stomach up into your esophagus, creating sometimes symptoms in your chest. What other symptoms might you have?
So it all depends on the severity. So certainly a burning sensation in the chest or throat. Some people will feel tightness in the chest. Some people will actually have nausea.
Well, hang on here. So you're talking about burning and tightness in the chest. I guess my question is, because I'm thinking of all the physicians that have come on and talked about heart situations.
Yep.
And I think particularly men often will be having a heart attack and they'll go, I'm not going in because I just got heartburn, right?
Yes, and that happens with women too. So this can be a mimicker, and sometimes it can be hard to sort out.
And when are these symptoms? I mean, you talked about maybe after a late meal or acidic food or fatty foods. Is there any other time where these symptoms, when you're having those, I mean, you need to get in and see a physician or call?
Absolutely. So I think if this is something that's new for you, and especially, if you're older or you have other sort of medical conditions and you're having new chest pain, I would not recommend writing that off as reflux. Okay, I think that would be reasons to be seen. And certainly if you're having other symptoms, things like shortness of breath, sweating, you're getting numbness in your arms and legs, I think you need to be looking at other things besides just reflux.
Okay, so if it is reflux and you're going to diagnose it probably mostly by history and physical and what the patient is describing, how do you treat it?
Probably the easiest things are making some lifestyle modifications, okay? So if you are overweight or you have had some weight gain, certainly weight loss would probably help with that. Dietary modifications and kind of excluding or limiting some of the foods we talked about earlier, those spicy, fatty foods, things like that can help. Not eating late in the evening, so kind of limiting your food intake, in the hour or two before you go to bed. Some people find that just raising the head of their bed, even like 4 to 6 inches, can help gravity help you out, okay? If those things aren't enough, there are medications. So if this happens to you every once in a while, you have more reflux instead of a diagnosis of GERD, even things like Tums and Rolaids are appropriate. If you're having it more often, there are other medications, and there's a class of medication called H2 blockers. So those are sort of the ranitidine, which is Zantac, which you can buy in most local stores. And then you can get prescriptions or even over-the-counter a class of medications called PPIs, which are proton pump inhibitors. And
those medications are essentially decreasing the output of acid in the stomach?
The PPIs are. So they make the stomach contents less acidic.
And the decrease in that acidity, I mean, does that interfere with any kind of digestion that these people might? Are there any sequelas or consequences of those?
Of course there are, yes, with all medications.
Yeah, exactly.
Right,
I kind of figured there was.
Yep. And so talking to your doctor about side effects, and especially I think there's some new data coming out about sort of chronic use of this class of medications called PPIs. There may be some issues with that, specifically related to some vitamin deficiencies and things like that. So those are important to talk to your provider about if you're going to be prescribed, and especially if you're going to be on it for years. Some people will have these symptoms 5 or 10 years, and then you need to be talking to your physician because you need screening, and you should also be aware of some of the side effects of those medications.
Okay, unfortunately, we're out of time, but you provided us great information on GERD. Thank you so much.
Yeah, thank you for having me. It's been a pleasure.
All right, our thanks to Dr. Heather Ostmann. More information at everettclinic.com, GERD, GERD, and there are over-the-counter medications that you can take, omeprazole, things like that, right?
Absolutely there is, yeah. The biggest thing is watch your diet, when you eat, what you eat, right? That's the big thing, right?
Yeah, eating pizza at 11 at night is probably...
You've done it before?
Yeah. Next guest, Dr. Grant Garcia, coming up next, right here, as we continue after this timeout on Como.